Our last presentation of this panel is going to be by Gina Schopfer, and her presentation is titled New Mothers in a New World.
Thank you. Let me know if anyone has any difficulty hearing me. I'm Gina Schopfer. My presentation is based off an article I have written titled New Mothers in a New World, First-Time Parenthood During the COVID-19 Pandemic. As a large portion of my presentation is based on stories collected through my interviews, my presentation does not have a visual component. COVID-19 has been described as the defining global health crisis of our time. Neither effective treatments nor a vaccine are yet available, and social distance measures still prove to be the most effective in preventing the spread of the virus. These measures put in place have required a massive societal shift, one that has altered reality for many. Although we do not know the long-term effects, it is certain a new normal will be established, one that affects different demographics in different ways. One such demographic is composed of first-time parents, and it is their experiences through the COVID-19 pandemic that will be the focus of this presentation and will outline the general challenges faced before and during the pandemic. The experiences highlighted will involve the pregnancy, the hospital experience, and life since childbirth. The presentation focuses solely on the experiences of first-time mothers. Real-life experiences have been provided by Shane Lawrence from Lethbridge, Alberta, and Courtney DeYoung from Lashburn, Saskatchewan, who were kind enough to undergo virtual interviews with me. As we all know, preventative measures, my apologies. COVID-19 has drastically impacted lives around the world and has put up a wall of caution around many of us. Those who are pregnant, especially for the first time, are already experiencing a new normal filled with uncertainty, and adding a pandemic into this process heightens the uncertainty. At the time of presenting, COVID-19 remains a relatively new disease, and society is still learning how it affects those who are pregnant. There is not enough evidence to confirm that COVID-19 could spread to a fetus during pregnancy, and current evidence shows those who are pregnant don't have a higher risk of getting COVID-19 and don't become more seriously ill than non-pregnant people who contract the virus. Much of the fear surrounding COVID-19 has arisen from its many unknowns that, at the time of presenting, still remain to be discovered. Some individuals show severe symptoms to the infection while others show none, making its spread difficult to track. And healthy children seem to have the best outcomes, with most not showing any symptoms at all. However, this makes containing the virus all the more challenging. Immunity and the ability of the disease to mutate is also currently unknown, thus the long-term effects can only be theorized. These unknowns have created feelings of anxiety and stress for many. For those preparing to have their first child, anxiety and stress are not unfamiliar feelings. The Public Health Agency of Canada has developed a sensible guide to a healthy pregnancy, containing useful tools and advice for pregnant women. This guide highlights typical questions and concerns had by those expecting and offers detailed advice and information regarding nearly every aspect of the baby's health during pregnancy. Aspects such as prenatal nutrition, physical activity, oral health, breastfeeding, and immunization are commonly thought about, but at a first glance one may not realize the many intricate details involved in each of these topics as well as many more. Those expecting are, of course, now responsible for the health and safety of at least two people. Putting one's own body under physical stress while preparing to take on the role of nurturing and protecting one of the most important people of your life is by no means an easy task regardless of COVID-19. Following the physically demanding process of pregnancy and childbirth comes even greater challenges. Raising a newborn comes with exhaustion due to sleepless nights, stress, and concern for the new baby. In a study conducted by Dr. Carol Brooks Gardner at the University of Indianapolis, half of 10 women interviewed said they suffered from severe depressive symptoms involving postpartum difficulties. During a time when mental health has been compromised for a vast majority of the population, this can be an alarming concern. Becoming a parent for the first time means taking on a brand new and ever-changing lifestyle while enduring physical change and discomfort as well as stress. Adding the COVID-19 pandemic into this picture does nothing but heighten existing concerns while adding new ones. Not only this, but each pregnancy experiences unique circumstances. Courtney DeYoung, new mother to Brecken, is a prime example of this. Brecken was born at just 28 weeks, 12 weeks premature. Courtney stayed at the Ronald McDonald House for 100 days from February to May with Brecken in the NICU. Courtney states, "I generally had no concerns about being pregnant and COVID-19 because I delivered before it was considered to be in Canada, though I believe it already was, and it was before Christmas, to be honest. I was more concerned for the health of our baby as he has a chronic lung disease from being born 12 weeks premature. I just hoped everyone took the care that we did as parents to keep our baby safe." Though Courtney did not have to deal with additional stress involving the pandemic during pregnancy and childbirth, the stay in the NICU fell at COVID-19's peak of the first half of 2020. She recalls her first time hearing of the coronavirus was at some point in February, and that she didn't feel concern until early March. Courtney states, "I only became concerned about COVID-19 when they locked up the hospital and changed visitor restrictions. I wasn't so much concerned about getting it at all, but not being able to see our baby who would be in the NICU for quite some time. Restrictions were going to be, first, only one parent for the remainder of his stay, and that parent would not be able to leave the unit. If they did, they were not allowed to go back in, so potentially our son could have been left alone. The second option was two parents allowed to come and go, but asked to go through screening every time we entered. This is what ended up being the case, which was the best case for us. Since Courtney has arrived home and has adjusted to life as a parent, she says it's actually fairly easy to adapt to the idea of a new normal. Everyday tasks and experiences have already been altered for new parents, so errands such as going to the store have already changed but have become harder. And it makes sense to not want to bring your child along, but sometimes that simply isn't an option." Courtney states that the worst part about this new normal is if you do need to do some running around and it's just you and your baby, the stares you often get for having them out is not tolerable to me. But I'm also a person who doesn't judge a book by the cover. This could be an only option for some mothers, and that's the sad part. A lot of people don't understand that. Our family at first, when we got home, implemented masks for the first couple weeks if they were coming to visit, and we held visitors to just immediate family. Then we slowly extended as guidelines allowed with the province. Strict hand washing is in place for sure, which honestly it always should be with a baby. But other than that, we are just as careful as we can be. Mothers can, at times, experience unfair judgment and scrutiny, as Courtney has. The New York Times reports nearly 2/3 of mothers saying they have been criticized for parenting decisions, according to a national poll released in June 2017 from C.S. Mott's Children's Hospital in Michigan. Out of the 475 mothers polled, 61 felt they had been judged regularly, with most of the criticism coming from close to home. Under recent circumstances involving the pandemic, concerns have been increased with the uncertainty comes opinions on how to best deal with the new normal, which has resulted in cases of judgment from outside parties. It's important to recognize the many challenges that come with motherhood, and that even during these times, there is not one correct way to parent. Shane Lawrence, new mother to Gracelyn, describes her pregnancy as relatively uneventful in comparison to Courtney's. Though her time during COVID-19 spread to Canada was short, my apologies. Though her time pregnant during COVID-19 spread to Canada was short, she was induced 10 days earlier than her due date of March 30th because of risks associated with COVID-19 and high blood pressure. Shane states, "Some of my biggest concerns were associated with actually giving birth in the hospital during a pandemic. When the first case was announced in Alberta in March, I began to get a bit anxious because I was currently on bed rest for high blood pressure and I was due at the end of the month. At the time, we really didn't know how bad it was, how full the hospitals would get, how fast the hospitals would fill up. There were so many unknowns. Before COVID-19 became a reality in Canada, its threat was of little concern. As this is something our society has never had to deal with to this extent before, it was incredibly difficult to predict the extent of its impact. Shane recalls this well. She states, "I remember hearing about the virus on the news in January and having it not seem very relevant or real to us here. It's such a shocking thing to think back to now. Later in February, we had a vet student shadow the clinic that I work at. He came from Australia and a few days after arriving here got pretty sick. Everyone began joking that he had the coronavirus, again never imagining it would actually affect us here. Following Gracelyn's birth, her perspective has shifted drastically. Shane states feeling a significant deal of fear around having to go back to the hospital or a doctor's appointment where the risk of exposure has felt higher. 2 days after being discharged from the hospital, Gracelyn was readmitted, struggling with jaundice. It was very difficult when they separated us at the door. Only one parent was allowed to go in with our 3-day-old baby. She states that parenthood has looked drastically different than how she imagined bringing her firstborn into the world. But with that being said, it has been magical and surrounded with a lot of joy. The accommodations that have had to be made are worth every moment." Shane states, "After arriving home, we isolated from family and friends. Thankfully, my mom was still able to come for the first 2 weeks to help us settle in. Aside from my mom, Gracelyn was 2 months before she met any other family members, and at that time, she met only my dad. Slowly, she has met other members of my family. My husband is from Australia, and unfortunately, all of his family still lives there, so they have had to cancel their flights that were booked for June, and there is still no timeline of when they will be able to meet her. Thankfully, we have 2 friends in our city that have been working from home that we are able to connect with in person. They have been our lifeline in day-to-day living." Shane describes in her interview the huge impact having a supportive and helpful partner has made in this situation. Dependable spouses, partners, and family members can help to lessen a portion of the responsibility felt by new mothers, or simply remind them that they aren't alone and help is there if needed. It is worth noting the significant number of first-time mothers who go through these experiences without a partner and feel the responsibility sitting solely on their shoulders. Stress during pregnancy can have a significant impact on the baby, so it is important to practice kindness towards all mothers, especially under these circumstances. Because women are still primarily responsible for caring for children, they are much more likely to be employed in only part-time work, while men are still able to be employed in full-time work. Single mothers are also less likely to be employed when compared to single fathers or married mothers. Although men spend more time on housework today than they have in previous generations, women still take on majority of the housework, even those who are working full-time outside from home. As women are more likely to be unpaid caregivers, when we discuss the experience of motherhood before, during, and after COVID-19, this is an important consideration to make. Those preparing for first-time motherhood without support have endless responsibilities, and the weight of this can likely feel overwhelming. Luckily, there are resources for these cases, even during the pandemic. Kaleo Collective is based in St. Albert, Alberta, and offers resource courses and a support group and a sense of community to single moms. Since the impact of COVID-19, classes have been offered virtually online. Kaleo Collective also provides an Adopt a Mom initiative where those able and willing to donate can provide help to single mothers involved with the group. As stated, the future of COVID-19 is still unknown, so it is currently impossible to know the length of time we will endure this restrictive lifestyle put in place. However, it is safe to assume that this new normal will be in place for an extensive amount of time. Practicing compassion and understanding is important for everyone's mental health, and special consideration practiced towards mothers is critical not only for the health of the mother, but also the child involved. Because arriving into a world much different than a year ago creates a life different than newborns have ever had to experience. Yet, we are still able to ensure these infants are properly nurtured and cared for. Thank you very much. I hope you have enjoyed my presentation and found it interesting, and I'll be happy to take any questions during the question period.
Thank you so much for your presentation, Gina. Okay, so next question is going to be for Gina. Zach is asking, is there any research you've done that agrees with the experiences of the woman you've interviewed?
Yes, what I've read online, based just on testimonials or direct experiences from women, describes similar hospital experiences. I also came across a COVID-19 prenatal experience study conducted by psychologist Jen Ablow, and in that study, um, it discussed including restrictions on people that could be present during a hospital birth and inability to access planned care options after delivery as well.
And I believe this is going to be our last question, and it's for Gina. Zach is wondering, how do you think the experiences of mothers today compares to the experiences of mothers in past pandemics?
I think experiences today have a lot of similarities between past pandemics when talking about uncertainty and fear and so on. But of course, today our world is largely based around the internet and social media. That can offer mothers a sense of community and feeling like they aren't totally alone, as well as providing useful suggestions and information regarding both the pregnancy and COVID-19. But that being said, I believe the internet today can also increase a heightened sense of fear and paranoia, just due to fear based stories you can read online and information that may or may not even be true.
Awesome. Thank you so much, Gina.